2020 has been a hard year. The pandemic has gone all over the world and has been affecting the medical world immensely. Essential workers have been having to do more because of this pandemic, and luckily I was able to sit down with my stepmother and to discuss the changes that have gone through her work and the medical field.
Work's changed a lot since the pandemic started. Not only are you having to review charts the night before, but sometimes even days before, because you can't have certain populations of patients coming in with other patients. So working in OBGYN, also along that has family practice, we also have oncology, which is cancer patients twice a week. So you have to review your charts ahead of time, because now you can no longer have any patients that have any type of COVID symptoms in with pregnancy patients or oncology patients. So you are consistently on the go from that.
As the pandemic continues, policies in clinics have been changing ever so much to ensure safety for the patients.
Our policies are ever changing, reflective upon the cases within the county we're in. Right now, we are down to one visitor policy only. What that means is that one visitor can only be your emotional support person or a parent. Otherwise, if you go to the ER, you have to go alone. If it's a patient who's, let's say, in NICU, which is preterm babies, you're allowed to have two parents at that time. But otherwise, no other patients are allowed in with you. And also that we enforce masks completely. No gaiters, because gaiters have been shown not to work as well. So if you're not, no masks with valves, because they don't work as well either. We will ask you to leave the clinic, and if you give us any grief for leaving the clinic without putting a proper mask on, we will have security remove you from site.
Medical workers also face new policies to ensure their safety when interacting with patients. This is some of them that she has to do daily.
So after every patient, you have to sanitize the room with gloves, of course, and you sanitize everything down. You wipe off the blood pressure cuff. You have to wear your mask at 8 hours a day, all day. Unless you're in a separate room, you have to wear one. If you're in the bathroom, you're wearing your mask, you know. If you have a COVID-19 patient that comes in, or someone that has symptoms of COVID-19, you have to gown up. You have to put a face mask on. We're already having to wear goggles, even if we have glasses on. So it's a whole 9 yards, and you have to put gloves on.
Then I asked her for some advice for this pandemic.
Stay home. Wear your mask. Use your hand sanitizer. You know, if you notice you're having any like little symptoms, you know, it doesn't have to just be loss of taste, you know, taste and smell. It doesn't have to just be that. You know, if you have a runny nose, you have diarrhea for a couple of days, you generally just don't feel unwell, call your doctor. You can easily get a COVID test. Everybody's offering free testing right now. You know, don't go to grandma's house if you don't have to. Don't go see great grandma. You know, I know people who live in assisted care facilities, and they have the worst cases going on in there, because that's more of a higher risk population. So if you can just stay home, that's the best thing. For people who do have to work, you know, proper precautions. Wear your mask all the time. You know, don't touch your face. Don't touch your nose, you know. Wash your hands, sanitize your hands on a consistency. You go to the grocery store, you're touching the shopping cart, you're touching your food. Then when you come in the car, just hand sanitize. Wipe your steering wheel down with it a little, because you've already touched it, you know. But that's the best thing to do.
And this has been Logan Bowman of Viking Students Media.